We finish up here, we summarize, we say squamous disease, it's 80% environment, 20% horse. We want to optimize our roughage intake, 2% body weight per day. We want to keep our carbohydrates less than 1 gram per kilo per day. We want to think about our quantity of exercise. We want to think about our timing of exercise and how it intersects with feeding, with a preference being in the afternoon or after significant intake of a hay meal. We want to add beet pulp to the diet. We can use omeprazole in specific circumstances. When we think about glandular disease, it's 80% horse, 20% environment. We want to focus on that environmental enrichment, that friends foraging freedom, where you can use specific interventions like massage and music, not just to make the horse feel better, but to reduce its disease risk and make it perform better. Supplements, specific supplements with appropriate evidence, I do think play a really important role in the chronic management of glandular disease, because once they have it, they tend to continue to have it. We want to manage the behavioral aspects of the disease to reduce anxiety, to reshape associations, and to build threshold and tolerance. And we can use omeprazole, but in a much more targeted way, say during specific competition and stuff. On the left here, I think what we're looking at is really, we talked a little bit about recognition. We didn't really talk about treatment, but we stuck at the bottom. We talked about prevention, but we're also talking about adaptation. What do we do for these horses that don't heal, don't respond? How do we teach them to improve their threshold tolerance and resilience to reduce the impact of disease on the horse and therefore benefits for the horse and ourselves?